And just kind of think about non-statin LDL lowering therapies. How do you sequence things like ezetimibe, bempedoic acid, PCK9, and all of those other things? How do you sequence those things in statin intolerant or very high risk patients, um, not at LDL-C goals?
Yeah. So oftentimes I will add a non-statin medication to a patient's statin dose if they are not at goal. If a patient is statin intolerant, then I could try an alternative therapy instead. And the reason why we do it this way in clinical practice is just because of what insurance companies cover, quite frankly. And we want to make sure that our patients are able to afford the medications that they're taking. And so you have to sort of demonstrate statin intolerance by this trial and error process that we just talked about. And if someone does truly have statin intolerance, then that's the point at which you would consider adding a PCSK9 inhibitor, which we know are a lot more expensive and may also have some barriers from the patient perspective, aside from cost, with regard to having to do injections, so weekly or biweekly injections, if you're using the monoclonal antibody PCSK9 inhibitors.
Mhm.
But specifically to answer your question about the bempedoic acid and the ezetimibe, uh, both of those medications are effective at lowering LDL-C cholesterol. However, the effect is not as strong as a PCSK9 inhibitor. And so, usually, if you have a patient who is high risk and you want to be very aggressive about lowering their LDL, oftentimes it does come down to having to consider the PCSK9 inhibitor.
Mhm. And in 2025, ESC EAS update specifically highlighted bempedoic acid and evinacumab. In what clinical scenarios are you finding that these agents are most impactful?
Well, I would say the bempedoic acid is an adjunct therapy at this stage, at least in my clinical practice. And so usually I'm reserving that for patients who, again, if they have a statin intolerance. Um, I've had some patients where we've considered adding ezetimibe. Sometimes folks who have statin intolerance will also have ezetimibe intolerance, but the bempedoic acid may be more beneficial. I've not used any of the other therapies that the ESC has recommended.